Welcome to Conspiracist.
Great to be here.
Today we're doing a deep dive into a really potent idea. The hypothesis that governments might have intentionally hidden evidence of, well, Big Pharma manipulations.
Right. It's a complex area, and there's a lot to unpack. We'll be looking at the history, the current claims, the whole picture.
Exactly. So where do we start? Maybe with the history. Because skepticism towards medical interventions isn't exactly new, is it?
Not at all. It's crucial to see that trajectory. Even way back early 18th century, smallpox variolation.
That was the precursor to vaccination, right?
Precisely. And even then, there was significant opposition. We're talking the 1720s.
Wow, that early. What form did that opposition take?
Well, you had religious arguments. Reverend Edmund Massey, for instance, gave a sermon in 1722.
What was his argument?
Essentially, that disease was, divine judgment. And trying to prevent it with this inoculation, it was like thwarting God's will.
Interfering with providence.
Exactly. And that wasn't just an isolated thing in England. You saw similar objections over in North America.
Oh, really? Who was involved there?
Figures like John Williams, William Douglas.
Yeah.
They raised concerns too. So right from the very start of immunization efforts, you see this deep-seated skepticism.
Okay, that's a really important foundation. So how did we get from those early, often religious objections to more, let's say, organized movements?
Well, fast forward to the late 19th century. That's when things really started to formalize.
You mean actual groups forming?
Yes, exactly. Anti-vaccination leagues. In the UK, you had the London Society for the Abolition of Compulsory Vaccination around 1880.
Okay.
And then the National Anti-Vaccination League in 1896.
Yeah.
These weren't just fringe elements.
They had publications, influence.
Yeah, they published things like the Vaccination Inquirer. They even got support from some, prominent people. George Bernard Shaw wrote a supported letter at one point.
And in the U.S.?
Similar story. The Anti-Vaccination League of America popped up in 1908. Their main focus was fighting mandatory vaccination laws.
So what was driving this wave? Still religious concerns or something else?
It was a mix. The religious arguments persisted for some, but you also saw growing concerns about personal liberty, the state forcing a medical procedure.
Right, the individual rights angle.
Exactly. Plus, questions about the safety and, frankly, the effectiveness of the vaccines themselves. This was happening even as evidence was mounting that vaccination was working against diseases like smallpox.
That historical context is really helpful. It sort of sets the stage for understanding the concerns we hear today, doesn't it?
Absolutely. The themes often echo, even if the specifics change.
So let's talk about those modern arguments. What are some key claims supporting this idea of hidden Big Pharma manipulations now?
Well, a really persistent one is the idea that natural or alternative remedies, things that aren't patentable pharmaceuticals, are actively suppressed.
For profit, presumably.
That's the core argument, yeah. That the pharmaceutical industry's profits depend on suppressing cheaper, potentially effective natural alternatives.
We also see very specific claims related to major diseases, right? Like HIV/AIDS.
Yes. There have been theories, completely unfounded by scientific evidence, mind you, suggesting that conventional HIV medications are actually harmful or ineffective.
And reputable journals have addressed this.
Oh, yes. The Lancet, for example, has published editorials specifically tackling and debunking these conspiracy theories with the actual science.
Okay. And what about cancer? That seems like a big one, too.
Definitely. The idea that there's a universal cancer cure out there, hidden away somewhere, it's a very powerful, emotive claim.
But the scientific reality is more complex.
Much more complex. Cancer isn't just one disease, it's hundreds. Progress has been incremental, based on decades of really intensive research. Finding one magic bullet that works for everything and is being hidden, it just doesn't line up with the science. Doesn't mean there aren't ethical issues in the industry, of course, but a single hidden cure is, unlikely based on what we know.
And then COVID-19, that seems to have just supercharged all these concerns.
It absolutely did. You saw widespread claims that the vaccines were ineffective or even harmful, and that, again, alternative cures were being suppressed.
So the general argument gets amplified, that profit comes before effective treatments.
Exactly. That pharmaceutical companies might actually hinder the development of truly effective medications if it impacts their bottom line. And this isn't just a fringe belief. A survey mentioned in the Italian Political Science Review actually found a notable segment of the public thinks this might be happening.
Wow. And this level of sort of public distrust, it spills over into politics and legal action too, doesn't it? Especially in the U.S.
Very much so. In 2023, we saw the House Judiciary Committee taking aim at disinformation research projects.
Like the Virality Project.
Precisely. They were studying how vaccine misinformation spread online. The committee issued subpoenas, demanded records from researchers at places like Stanford, the Atlantic Council.
Which must have raised alarms in the academic community.
Huge alarms. Researchers pushed back hard, citing academic freedom, freedom of speech, the right to study these phenomena without political interference.
It's a tricky balance, isn't it? Tackling misinformation versus potentially chilling legitimate research.
Extremely tricky. And we also saw individual scientists facing intense pressure. Peter Hotez, for example.
Yeah, he's been very vocal about the harassment he's received.
He has. He's described pretty aggressive attacks, linking the increased hostility to certain political factions. He even estimated a large number of preventable COVID deaths among Republicans, specifically due to vaccine refusal. It really highlights the real-world stakes.
And wasn't there also a legal challenge from some state governments about the Biden administration talking to social media companies?
Yes, that was another significant development. Several states argued the administration was improperly pressuring platforms to remove COVID misinformation.
How did that play out?
Well, they initially got a preliminary injunction limiting those communications. But that was later put on hold by the Supreme Court pending review. It's part of this ongoing, really contentious debate about government roles, free speech, and online information.
So while that's happening at the higher levels, what about on the ground? Were there efforts to counter misinformation directly in communities?
Oh, absolutely. Lots of different approaches were tried. Things like call centers set up to answer people's questions directly, texting campaigns, pushing out accurate information, partnerships with, trusted local leaders, pastors, community organizers.
Trying to reach people through familiar channels.
Exactly. And setting up community-based vaccine clinics, making access easier. Plus, a big focus on improving digital and science literacy, giving people the tools to evaluate information themselves.
Despite those efforts, though, false claims kept circulating pretty widely.
Unfortunately, yes. Social media remained a major conduit. You saw attempts to link almost any sudden death or health issue to vaccines.
Like the incidents with athletes, Damar Hamlin, Bronny James.
Right. Both had cardiac events, completely unrelated to vaccines, as investigations later showed Hamlin's commotio cordis, James's congenital heart defect. But they were immediately seized upon. Same with Taylor Hawkins' death, which was due to a drug overdose.
And sometimes it was more deliberate misrepresentation.
Yes. The New York Times actually investigated the death of a man named George Watts, Jr., showing how anti-vaccine activists distorted the circumstances to fit their narrative.
The language used can also be quite extreme, can it?
Yeah, the term purebloods being adopted by some unvaccinated individuals is, well, it's disturbing, given its historical echoes of racial purity ideologies.
Grim. And wasn't there a study linking political affiliation and mortality rates post-vaccine rollout?
Yes, a 2023 JAMA study looked at Florida and Ohio and found higher excess mortality rates among Republican voters after vaccines became widely available, suggesting a correlation between political leaning, vaccine uptake, and outcomes.
And just outright false stories circulate, too, like about the Pfizer CEO.
Oh, yeah, the claim he wanted to reduce the world population? Totally baseless, debunked, but it still gets shared. It shows how sticky these narratives can be.
Okay, let's shift gears a bit and talk about the money side. The pharmaceutical industry itself, there are legitimate financial and ethical questions, right?
Absolutely. Developing drugs is incredibly expensive. The R&D costs are massive. That's undeniable. But there are practices that raise eyebrows. For example, reports like those Dr. Moffitt described about doctors getting paid significant sums for speaking engagements, basically promoting specific drugs.
Which creates a potential conflict of interest.
A clear potential conflict. Are they recommending the best drug for the patient or the one they're being paid to talk about? It erodes trust.
And this led to actual legislation, didn't it?
It did. Testimony before Congress, like Rosen's, was part of the push that led to the Sunshine Act.
What does that do?
It mandates more transparency. Companies have to report payments they make to doctors and teaching hospitals. The idea is to bring these financial ties out into the open.
Because the core ethical issue is that financial incentives shouldn't override the doctor's duty to the patient, the Hippocratic Oath.
Precisely. Patient well-being has to come first. And sometimes companies have definitely crossed the line.
There have been major legal cases, settlements.
Oh, yes, some huge ones. GlaxoSmithKline paid a $3 billion settlement related to off-label promotion and other issues. Abbott Labs, Eli Lilly, They've also faced massive penalties for fraudulent marketing and other misconduct.
So there is regulatory action sometimes.
There is, but these settlements often happen after the damage is done. And critics argue the penalties sometimes aren't enough to deter behavior when the profits are so enormous.
And just the sheer cost of drugs is a huge issue, particularly in the U.S.
It really is. You see studies, like in the Wall Street Journal, showing prices here are just way higher than in comparable countries, Norway, England, Canada.
Why is that?
It's complicated, our market system, patent laws,
Yeah.
lack of direct government price negotiation for many drugs, lots of factors.
There was that big case involving Gilead's hepatitis C drugs, Sovaldi and Harvoni, right? Extremely expensive, but also very effective.
Yes, revolutionary treatments, but launched at incredibly high prices.
Right.
And then there was a massive patent fight with Merck over them.
What happened there?
Merck actually won a huge jury award initially, like $200 million, but then the judge threw the whole verdict out.
Why?
Because of misconduct by Merck's own attorney during the process. The judge cited something called unclean hands, basically saying Merck hadn't acted ethically in the litigation itself. It was quite dramatic.
Wow, it shows the high stakes involved. And even for chronic conditions, the costs can be astronomical
MS.
of drugs.
Yeah, some treatments for multiple sclerosis can run like $62,000 a year, maybe more.
And what drives those prices? Again, R&D, patents.
All those things play a role.
Hmm.
Research costs, keeping exclusivity through patents, the level of competition, including from non-drug approaches like lifestyle changes, though those aren't direct market competitors in the same way.
Are there programs to help patients?
Yes, thankfully. Many pharmaceutical companies offer patient assistance programs that can significantly lower the cost for people who meet certain income criteria. But navigating those can be complex, and not everyone qualifies.
Okay, so we've touched on history, modern claims, legal issues, financial aspects. Let's get back to vaccines specifically and the safety concerns that keep cropping up.
Right. It's vital to state up front. The overwhelming scientific consensus, based on decades of evidence, is that licensed vaccines are incredibly safe and effective.
But side effects can happen.
Yes, like any medical intervention, there can be side effects. Most are mild and temporary sore arms, slight fever. Serious adverse events are very, very rare.
So the benefit vastly outweighs the risks.
For the recommended vaccines, absolutely. The risk from the diseases themselves, measles, polio, diphtheria, COVID-19, is far, far greater than the risk from the vaccines designed to prevent them.
But specific safety scares do emerge. Is there a pattern to how those play out?
There often is. You might see an initial study, sometimes small or methodologically flawed, suggesting a link between a vaccine and some condition.
Okay.
Then, larger, better designed studies are conducted, and they fail to replicate the finding. The original claim gets debunked by the wider scientific community.
But the initial fear lingers.
Exactly. It takes a long time to rebuild public confidence once a scare takes hold, even after it's scientifically refuted. And interestingly, these fears can be culturally specific confidence. Different concerns pop up in different places about different vaccines.
The MMR vaccine controversy is probably the most infamous example of that pattern.
Absolute textbook case. Andrew Wakefield's 1998 paper in The Lancet claimed a link between the MMR vaccine and autism.
And it caused a massive
Panic. Huge panic. Vaccination rates plummeted in the UK and elsewhere. Measles outbreaks followed.
But the paper was eventually retracted.
Fully retracted. It was found to be fraudulent, based on manipulated data, and Wakefield had major undisclosed conflicts of interest. He was being paid by lawyers, suing vaccine manufacturers, and was developing his own rival vaccine.
And he lost his medical license over it.
Yes, struck off the medical register. But despite countless large-scale studies since then showing definitively no link between MMR and autism, that fear persists among some parents.
And related ideas, like vaccine overload.
Also thoroughly debunked. The idea that giving multiple vaccines overwhelms a child's immune system just isn't supported by immunology. Kids encounter far more antigens naturally every day, but it's another persistent myth.
We've even seen stranger concerns more recently, like demanding blood only from unvaccinated donors.
Yes, that emerged during COVID. There's absolutely no scientific basis for it. The vaccine components aren't transferable through blood in any harmful way. It creates huge ethical and logistical problems for blood banks.
So lots of specific fears, MMR, overload, blood transfusions have been investigated and debunked. What about other claimed links? Seizures, allergies, MS?
All have been extensively studied. While febrile seizures can rarely occur after some vaccines, they don't cause long-term harm. There's no credible evidence linking vaccines to the development of allergies, multiple sclerosis, or other autoimmune diseases. The research just doesn't support those connections.
Another common claim is that getting the disease naturally gives you better immunity than the vaccine.
Sometimes natural infection can lead to very strong immunity, but it always comes with a risk of severe illness, complications, or even death from the disease itself. Why risk measles, pneumonia, or encephalitis when the vaccine prevents the disease safely?
And sometimes the vaccine immunity is actually better.
Yes. The HPV vaccine is a great example. It provides broader and potentially more durable protection against the cancer-causing HPV types than natural infection does. And diseases like measles can actually damage your immune system for months after infection, making you more vulnerable to other things. Vaccination doesn't do that.
Okay, so the science on safety seems pretty robust for licensed vaccines, but the distrust clearly remains. Where does that come from?
Well, as we discussed, there's that historical context. But also, you have accusations, often from alternative medicine proponents, that the industry actively misrepresents safety data.
The profit motive argument again.
Right. That information is suppressed, that policy is unduly influenced for financial gain. Now, it's true that vaccine development wasn't always hugely profitable. In the late 20th century, profit margins were often low.
What changed?
The market improved with newer, so-called blockbuster vaccines. But even so, vaccines still make up a relatively small slice of the total pharmaceutical pie compared to drugs for chronic conditions.
But have there been real instances of malpractice or fraud that have damaged trust? Things that aren't just unfounded claims?
Oh, unfortunately, yes. And these can have devastating consequences. A prime example is the CIA using a fake hepatitis B vaccination program in Pakistan to try and gather DNA intelligence related to finding Osama bin Laden.
That actually happened.
It did. And when it came out, it massively damaged trust in all vaccination programs there, setting back polio eradication efforts significantly. Health workers were attacked. It was a disaster for public health born from deception.
That's incredibly damaging. Any other examples?
Well, there have been issues with transparency in clinical trials sometimes. The Covaxin trial in India, in Bhopal, faced criticism because some participants reportedly weren't properly informed they might be getting a placebo, not the actual vaccine candidate. That sort of thing erodes trust.
And we mentioned religious objections earlier. Those still exist too, right?
Yes. Beyond the historical thwarting God's will argument, some contemporary objections relate to the use of cell lines derived from fetuses aborted decades ago in the development or testing of certain vaccines. While the final vaccine contains no fetal tissue, the origin is an issue for some.
So it's not just about presenting facts. Addressing hesitancy is more complicated.
Much more complicated. The old idea, the information deficit model, just give people the facts and they'll change their minds. We know that often doesn't work. Hesitancy is tied up in trust, values, identity, past experiences.
And it seems to be a growing concern, particularly in wealthier countries?
It is, paradoxically. Vaccine hesitancy is now seen as a major global health threat, often more prevalent in industrialized nations across different socioeconomic and education levels. It's not just an issue of lack of education.
And the consequences are real. We're seeing diseases come back.
Absolutely. The recent increases in measles cases, for instance, in the U.S. and globally, are directly linked to pockets of undervaccinated populations. These are preventable diseases making a comeback because vaccination rates have fallen below the threshold needed for community immunity.
That really underscores the stakes involved in this whole complex issue.
It really does. It spans history, science, politics, ethics, and has direct impacts on public health.
Thanks for listening to Conspiracist.